Good day, I am Cadet Captain Aloha M. Camacho, CL-01 Mandayog, 2nd class, born on October 25, 1998, lives in Luciente 2nd, Bulino, Pangasinan. I'm taking Bachelor of Science Mathematics Pure at Pangasinan State University at Lingayen Campus. Military experience, Cadet Officer Qualifying Course, 3rd class CL-01 Bogani 2019-2020. Classroom rules. Keep your phone at the silent mode. If you feel sleepy, go at the back and perform some exercises. In case of fire, go and find the fire exit. In case of earthquake, do the drop, cover, and hold on. Our topic is Basic Life Support 4. Scoop. First aid for circulation, airway, and breathing emergencies. Cardiovascular resuscitation, rescue breath, and choking. Objective. To acquaint the student on the different medical terms that is strange to them. To understand the importance of the subject, the basic life support. First aid. Airway. Airway must be open so that air containing oxygen enters the body. Breathing must stay clean so that oxygen passes through the lungs into the bloodstream. Circulation. The person involved in the emergency situation is not breathing. To do the CABS or circulation airway breathing, circulation is to push hard and fast on the center of the victim's chest. Airway is to tilt the victim head back and lift the chin to open airway. Breathing is to give mouth-to-mouth rescue breath. Cardiovascular resuscitation. Cardiovascular resuscitation, or CPR, is a life-saving technique useful in many emergencies, including heart attack or near drowning in which someone's breathing heartbeat has stopped. Ito ay isang pangunahing panglunas na sa emergency, kabilang ang atake sa puso or malapit sa pagkalunod kung saan huminto ang paghinga o tibok ng puso. This is combination of chest compression and rescue breath. A step-by-step procedure on administering CPR. Survey the scene. Is the scene safe for you and the victim? Is there someone who can help? If the scene is secure for you to perform first aid, kindly proceed by introducing yourself and asking if you can help. This enables you to gain the trust of the victim as well as the people around the scene. Primary survey. Conscious airway breathing circulation. Tap both shoulder and ask the victim for what happened. Take note for the appropriateness of verbal response. Tapakin daw natin ang magkabilang balikat ng biktima at tanungin kung ano ang nangyari, tandaan ang pagtanggap ng verbal na sagot. Next, check for the patency of nostrils and mouth using head tilt, chin lift. Suriin daw natin ang patency ng butas ng ilong at bunganga sa pamamagitan ng ulo, ikiling ang baba upang malaman kung ito ay meron pang circulation ng paghinga. Check for breath sounds as well as the rise and fall of the chest. Note for difficulty of breathing. Suriin ang tunog ng paghinga at pagtaas-baba ng dibdib. Pansinin din natin kung mayroong sinyalis na nahihirapan sa paghinga. Check for false carotid or radial consciousness. Suriin ang pulso, carotid or radial consciousness. Chest compression. Using the heel of the palm interlace with the other hand, perform 30 compressions, approximately 2 inch deep on the middle of the chest, just in line with the sternum area of chest compression. Gamit daw ang ating sakong ng palad na naka-interlace sa isa pang kamay, gumawa ng 30 compression na tinatayang merong 2 inches ang lalim sa gitna ng dibdib sa tapat ng sternum. A cycle of chest compression is composed of 30 compression at the rate of 80 to 100 per minute. After a cycle, 2 rescue breaths are administered. Ang proseso ng chest compression ay binubuo ng 30 compression na tinatayang 80 to 100 compression kada minuto. Matapos ang proseso ng chest compression, susundan ito ng 2 rescue breath.
Suddenly collapse, it's important to act fast. Helping to save a life is easier than you might think. Just start hands-only CPR. The first step is to send someone to call your local emergency response number or call it yourself. Then get directly over the victim. Put the heel of one hand in the center of the chest. Then put your other hand on top of the first. Then push hard and fast in the center of the chest until help arrives. It's important to push, giving 100 to 120 compressions per minute, which is about the same tempo as this song. Let's hope you never have to use hands-only CPR. But if you see a teen or adult suddenly collapse, don't be afraid to try it. Remember, call your local emergency number, then push hard and fast in the center of the chest until help arrives. Your actions can help save a life. To learn more, visit international.heart.org.
Condition when CPR is needed. The victim is conscious. Kung may malay daw po ang pasyente, pulse is weak or no pulse. Kapag mahina ng pulso or wala na, no breathing or difficulty in breathing, cardiac arrest caused by coronary heart disease, dysrhythmias, respiratory arrest, electrocution, drowning, choking, or trauma. Rescue breath. Rescue breath is a giving oxygen via mouth-to-mouth, held tilt, chin left, pinch the nose, and give a blow of air directly to the mouth twice. Note for the rise and fall of the chest. Ang rescue breath daw ay ang pagbibigay ng oxygen sa pamamagitan ng mouth-to-mouth, ikiling ang ulo at bahagyang itaas ang baba. Pisilin ng ilong at bigyan ng hangin direkta sa bunganga. Obserbahan ang pagtaas-baba ng dibdib. If the chest did not move, check for the airway patency or tilt the head. Kung walang paggalaw sa dibdib, suriin ang airway patency o ikiling ang ulo.
Alright, now let's cover rescue breathing, adult rescue breathing. This is going to be a situation where the scene is safe, your gloves are on, your CPR shield's available, you arrive to find a victim unconscious, at least appearing unconscious, you call out to them, they do not respond to your verbal stimulus, you walk up, the scene is safe again, tap and shout on the collarbone, they do not respond. You check for a palpable pulse, and it's easily palpable, but they do not appear to be breathing. We activate the emergency medical services or call a code, and if we have a bystander, we tell that bystander, hey, you, go call 911 and come back. I might need your help. They respond. Now we know that because this patient has a palpable pulse but is not breathing, they're going to need rescue breathing. So we're going to tilt the head back, lift the chin, seal with the mask, and we're going to deliver one rescue breath over a second every 5 to 6 seconds for 2 minutes. After 2 minutes, we're going to assess for a pulse, no more than 10 seconds. If it's still easily palpable, meaning we can feel it easily, but there's no breathing on his own, or no appreciable breathing, we're going to continue rescue breaths, one breath every 5 to 6 seconds for 2 minutes, and keep reassessing. If at some point they lose their pulse, can't feel it anymore, and they're still not breathing, that's when we go into CPR. But as long as they keep a pulse and are not breathing, we're going to continue rescue breathing and wait for EMS to arrive or the next advanced life support team to arrive and take over. Scene is safe, my gloves are on, my CPR shield's available. Sir, can you hear me? Sir? Sir, can you hear me? There's no response. Hey, you in the plaid shirt, would you go call 911? I've got a man who's unresponsive. I might need your help. Please come back. Checking for a pulse. Oh yeah, he's got a nice strong pulse, but he does not seem to be breathing. I'm going to begin rescue breathing. 1,000, 2 1,000, 3 1,000, 4 1,000, 1 1,000, 2 1,000, 3 1,000, 4 1,000, 1 1,000, 2 1,000, 3 1,000, 4 1,000. And I'm going to continue this for about 2 minutes. Check for a prime pulse. If no pulse, if no breathing, start CPR. If there's still a pulse but no breathing, continue rescue breathing for another 2 minutes and then reassess.
Choking, ang pagkabara ng windpipe sa isang seryosong sitwasyon na maaaring dahilan ng pagkawala ng malay pagkamatay ng tao ang prosesong magkaiba para sa bata na wala pang 1 taon. Ang choking due to windpipe obstruction is a serious situation that can make someone lose consciousness and even die if the obstruction isn't removed. The procedures are different for babies who are less than a year old. If the person is consciousness and old enough to respond properly, as if they are choking before you start first aid. In anyone but an infant, that means performing the Heimlich maneuver. Kung ang biktima daw ay may malay pa at matanda na para tumugon, ay tanungin muna ito kung sila ay nag-choke bago simula ng first aid.
Listen up. What to do if you or someone starts choking. Now, I want you to pay close attention to everything we're about to show you so that you'll know exactly what to do in all kinds of choking emergencies. And you're going to want to share this with your friends so they might be able to help you in case you're choking. Oh, and don't forget to subscribe to our channel and turn on post notifications to keep up with all our important updates. All right, number 1, assess the situation. So first of all, determine if the airway obstruction is partial or total. This will allow you to figure out what you should do to help. If the choking person can still speak, cough, or cry out, it means the airway obstruction is partial. The person can still breathe, but might get pale because breathing is obviously restricted. When the airway obstruction is total, the person won't be able to respond to you, cough, or breathe. The victim will also likely grab at their throat, and their fingernails and lips might start turning blue. This is all caused by the complete lack of oxygen. Number 2, encourage them to cough. The right thing to do? If the blockage is partial, tell the person to cough. Coughing is the most effective way to clear the airways and push the stuck piece of food out of the trachea. The best thing you can do in this situation is to calm the person down, reassure them that everything's going to be okay, and encourage them to cough. The wrong thing to do? When some people are choking, they try to suppress a cough, straighten out their back, and breathe through their nose. This is the worst thing you can do in this situation. Drinking something while choking isn't the best idea. Give the victim a glass of water once the throat is clear again. Number 3, if the person can't cough, slap their back. The right thing to do? If the victim can't cough, the first thing to do is stand behind them and lean them forward. You can use your knee or the back of the chair for support. Deliver up to 5 strong blows between the shoulder blades using the heel of your hand. Be sure to direct the blows upwards toward the victim's mouth instead of doing regular horizontal claps. Pause after each blow to see if it worked. This should help kick the lodged object out of the airway. The wrong thing to do: never administer blows to a person who's standing straight up, and don't use your fist. This will only cause the piece of food to fall deeper down and block the airways tightly. If they start to cough, stop slapping their back. Number 4, if the person can't breathe, perform the Heimlich maneuver. The purpose of the Heimlich maneuver is to push out the air in the lungs that's not being used in breathing. It effectively drives out the stuck object. The right thing to do? Stand behind the victim and put your arms around their torso. Clench one hand into a fist and place it on their stomach between the belly button and the lower ribs. Then cup your other hand over your fist. Now quickly thrust your fist up toward the victim's diaphragm several times. Keep doing this until you've cleared the airway. The wrong thing to do is don't slap the victim on the back. It can only make things worse. And make sure your arms aren't around the person's ribs, or else you risk breaking them. Your arms should be below the ribs instead. Number 5, helping an unconscious person. The right thing to do is, if the victim is passed out, lay them down on their back. Sit on their hips and face them. Put one of your hands on top of the other and place the base of your palm between their belly button and lower ribs. Vigorously push the abdomen toward the diaphragm. Repeat this several times until the airway is clear again. If the person doesn't start breathing once the object has been removed, it's time for CPR. The wrong thing to do is do not keep the victim in an upright position. It's also a terrible idea to start doing CPR before you remove the blockage from the trachea. Number 6, helping yourself. Now, if you're choking and starting to suffocate, but there's no one around to help, you can save your own life. The right thing to do, start coughing, and if it doesn't help, perform the Heimlich maneuver on yourself. To do this, make a fist and hit yourself in the area between your belly button and lower ribs. Drive your fist up and down in J-shaped motions. If that doesn't help either, bend over a chair, the corner of a table, or any other solid object at waist level and push against it as hard as you can, keeping your arms stretched out in front of you. Do this until the object becomes dislodged. Wrong? As impossible as it might seem, try not to panic. The more you panic, the more air you let in through your mouth, and incoming air will only push the stuck piece of food further in. Do not stand straight up or hit yourself on the chest or back. Number 7, helping pregnant women and obese people. To help people who have a bigger belly, like pregnant women or obese individuals, you have to slightly modify the Heimlich maneuver. Place your hands as close to the abdomen as possible, higher than you normally would. Your hand should be right above the victim's lower ribs. You won't be able to do the regular upward thrusts, so press the chest really hard with quick thrusts instead. Repeat this procedure until the person stops choking, but don't continue if they become unconscious. Number 8, saving a choking infant. If the victim is less than a year old, lay them face down on your forearm. Make sure the head and neck are lower than the torso and support the chin in your hand. Make 5 quick blows right between the infant's shoulder blades with the heel of your hand. If that doesn't help get the stuck object out, turn the baby on its back. Use your hand to support the head and neck, which again should be lower than the torso. Use 2 fingers to make 5 quick thrusts right on the breastbone. If the baby starts coughing, stop and let it cough up the object. Number 9, saving a choking child. If the victim is older than 1 year, you have to follow different rules to save them. Stand behind the child, or if they're really small, get on your knees. Put your arms around the child's waist. Clench one hand into a fist and place it between the ribs and belly button with your thumb upwards. Grasp your fist with your other hand. Move your elbows to the sides and press the child's stomach with quick inward and upward thrusts. Number 10, saving an unconscious child. If the infant or child is unconscious, try laying them on their back first. Tilt the head back by lifting the chin up. Now, if you see the object stuck in the back of the throat, use your fingers to remove it. If you've successfully removed the object, cover the child's mouth and nose with your mouth and push air into their lungs. Feel if the chest has started moving and listen for breathing. If the child still isn't breathing, or if you were unable to dislodge the object from the start, begin chest compressions. Remember, for small children, it'll be 2 fingers pressed over the breastbone. Start doing cycles of 5 compressions and 1 breath. Call 911 if you haven't yet, and keep doing CPR until they arrive. Number 11, saving a choking dog. To help a dog in trouble, first make sure it's really choking and not suffering from kennel cough or heart disease. If the dog is unable to swallow, drooling excessively, coughing forcefully, and acting weirdly agitated, it clearly means the animal is actually choking. If it's still breathing all right but clearly has an obstruction in its airway, give it a few minutes to try and cough it out. If that doesn't help, open the dog's mouth with one hand on the upper jaw and the other on the lower. To avoid serious injury to you, cover the dog's teeth with its lips while you grasp the jaws. Take a flashlight and look as deep down his throat as you can. If you see something blocking the airway, carefully remove it with a set of pliers. If that doesn't work, try using back blows. The same thrust between the shoulder blades with the heel of your hand work for both humans and dogs. About 4 to 5 sharp blows should be enough. If and only if nothing else helps, administer the Heimlich maneuver. Hold the dog around its waist with its head pointed down. Make a fist with one hand, place it under the dog's rib cage, and cup it with your other hand. If your dog is small or medium-sized, use 2 fingers instead of a fist. Repeat sets of 3 to 5 inward and upward thrusts. Be careful not to crack its ribs. Take your dog to the vet for a health check straight away, even if you manage to remove the blockage yourself. So, have you ever helped someone who was choking? Was it hard? Share with us in the comment section. Like this video, send it to your friends, and help spread the word. Subscribe to our channel to not miss any of our updates. Stay with us on the bright side of life.
Choking. Sign of choking. Gagging, gasping o wheezing. Hirap sa paghinga ng biktima. Inability to talk or make noise. Di makapagsalita. Turning blue in the face. Pag-iba ng kulay ng muka. Grabbing at the throat. Paghawak sa leeg. Waving arms, paghaway ng kamay, at appearing panic. Ang pagpapanik ng biktima. Summary. Airway must be open so that air containing oxygen enters the body. Breathing must take place so that oxygen passes through the lungs into the bloodstream circulation. The person involved in the emergency situation is not breathing. Cardiovascular resuscitation is a life-saving technique useful in many emergencies including heart attack or near drowning in which someone's breathing or heartbeat has stopped. This is a combination of chest compression and rescue breath. Rescue breath is that if the chest did not move, check for airway patency or retilt the head. Choking if the person is conscious and old enough to respond properly, as if they are choking before you start first aid. In anyone but an infant, that means performing the Heimlich maneuver. Ulyss. At the end, we have some question here that you must answer. Thank you.